Hello, everybody. Thank you for getting settled in and joining us here. We'll be getting started in a few minutes. We're just going to wait for some people to trickle on in. So sit tight and we'll be back in a few minutes and get started. All righty. Good afternoon, everyone. My name is Kyle Stupai. I am a physical therapist and clinical director for Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as those of you who are joining us for the first time today. We appreciate you guys taking the time out of your busy days to learn with us. For those of you who don't know who we are, Spear is a private outpatient practice that's been around for 20 years, currently with 20 locations located all over the New York City and metro area, including in Westchester, where I reside. We have successfully continued to offer in-person care throughout the COVID-19 pandemic, and will continue to do so. And we will also have our Spear Live for those of you who are looking to stay in and receive our care during tele services for the comfort of your own homes. In our clinics, we're strategically going above and beyond CDC guidelines to ensure everybody's safety and well-being, from our patients to our staff and anyone who enters our facilities. You can find more detailed information on these safety measures by visiting our website at spearcenter.com. We're here for you today, which means that we want you to feel comfortable. So if you're looking for some individualized care, either in clinic or through telehealth, please reach out to any of us through our Q&A feature at your earliest convenience, and we'll get you set up for an appointment right away. And we'll put our contact info at the end of the presentation today. We're excited to be with you today to discuss some weightlifting and breathing techniques, how to properly breathe and brace your core to lift heavier things and avoid injury, something we can all learn from. As part of our session today, we'll be talking through and demonstrating some of these exercises, and we welcome you to follow along and practice with us as you feel comfortable. Please note if you're experiencing any pain while performing any of these exercises, or you just feel unsteady or unsafe when you're doing them on your own, please stop, reach out to us directly, and we'll be here to support you. As you can see, we're coming from our own homes and offices, so we don't anticipate any technical issues today, but please be patient with us should we have any arise or any awkward timing stalls that we tend to get on these technology platforms. Throughout this webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature located at the bottom of the screen. Please don't use the chat feature or raise your hand. We're going to primarily be monitoring the Q&A feature. So please take a minute to hover over your screen at the bottom. You'll see the Q&A pop up. That's where you'll be able to get a hold of us. Please put your questions in there. We'll have a little Q&A section at the end of the webinar to be able to answer anything that you have and direct you to the best answer. For those of you who are viewing us on YouTube Live, welcome. We're monitoring the comment section there as well. So please feel free to type in your sections in the comment section only for YouTube. And lastly, there will be times where we'll have multiple panelists that are going to be on the screen at the same time with some PowerPoint slides. For the best viewing experience, on the top right corner, you'll see view. Make sure to select gallery view so you can see all of us at the same time while we demonstrate and can simultaneously go through that. All right, so we're gonna bring up a little slide right now. We're gonna go over our goals for today with some of the things that we'll be covering. So number one, we're gonna go over the sport of weightlifting and what it is. We'll go over some diaphragmatic breathing, exercise mechanics, and how to properly brace your core. Should you or shouldn't you use a lifting belt? And we'll go over some proper breathing during heavy lifts or light lifts. And finally, we'll wrap it all up with questions that you have live with our panelists here. Alrighty, so before we get started with the formal presentation, we'll take a couple seconds to meet our panelists. So we bring everybody up here. First, we have Andrea Bettini. She is a physical therapist at our Park Slope office in Brooklyn, and she is also CrossFit Level 1 certified.
Hi, guys.
Next, we have Brittany Smith. She's another physical therapist of ours from the Brooklyn Heights location, and Brittany is USA Weightlifting certified as well.
Hi, everyone.
And lastly, we have Brett Warner, who is a physical therapist and our assistant director at our Park Slope office. So we have the whole Brooklyn team.
Hey guys, thanks for joining us this evening.
All right, Brett and I are going to be monitoring the Q&A in the background. I'll be back in a little bit to go through that with you guys. But for now, we're going to step away and we're going to let Brett and Andrea handle everything.
Perfect, guys. I'm just gonna there you go. Waiting for the slides to come up. Today we're going to talk, me and Brittany are going to talk to you guys a little bit about weightlifting and what is the first thing you should probably know about weightlifting. So first thing we should know about what is weightlifting. So weightlifting, it's a form of strength training that uses a variety of resistance. It could be a barbell, it could be a dumbbell, weighted balls. Usually involves two types of muscle or activations. It involves concentric movement and eccentric movement, which usually we use against gravity. However, the sport of weightlifting itself, it involves two bigger movements, which is the clean and the jerk and the snatch. Both of these movements are, or it's what we call Olympic weightlifting. It's an Olympic sport, and it requires moving the bar from the ground to an overhead position through a variety of steps. It is both of the movements are very technical. They require a lot of coordination, strength, and flexibility. They're very, very hard to master. And the goal of it is just pretty much to lift as much weight as you can. Next slide, please. The first thing you should probably know about weightlifting, it's not necessarily how to do it, but how to breathe through it. Most of us, even experts and Olympic athletes, forget or have difficulty doing this, and it's just necessarily how to breathe through the movement and how to properly use your core and breathe properly to avoid injuries. So I'm going to take you a little bit through breathing mechanics, what normal breathing mechanics is and how we normally do it. So normally breathing is something that is controlled by the brain. You're not thinking necessarily breathe in, breathe out, breathe in, breathe out. It just happens unconsciously. However, it is something that you can train yourself to do, and it's something that you can like strengthen your muscles to do properly. So usually what happens during breathing, it's like you use your main muscle of respiration. It's your diaphragm, which if you can see in the picture next to us, it's located underneath your rib cage and above your abdomen. So it separates the chest cavity from your abdominal cavity. It is a dome-shaped muscle that when it contracts, it contracts during inhalation. So when you're taking a deep breath in, the muscle contracts down and it helps expand the rib cage. That way you can get your air into your lungs. And pretty much when it exhales, or when you exhale, the muscle relaxes and it naturally allows for the air to flow out of your rib cage. There's different types of breathing or different types of yeah, there's different muscles you can use for breathing. I'm going to take you guys through diaphragmatic breathing, which is using this muscle to actually use to use it properly, which will help us later on bracing our core and using it to breathe and not necessarily to brace. So I'm going to have Brittany come up on stage with me. She's going to demonstrate how to do it. I'm going to guide her. But what we're going to go through, like I said, is diaphragmatic breathing, which is using the diaphragm that I just spoke about to breathe. So what you're going to do, if you guys are following, please follow along with us. You can look at Brittany for a physical graphical demonstration. So you're going to grab one hand and you're going to put it on top of your chest. You're going to grab the other hand and put it right underneath or right above your tummy. From here, you're going to just take 3 deep breaths. You're going to inhale through your nose. So you're going to breathe in through your nose, and you're going to exhale through your mouth. Not in no particular way, just like you would normally do it. After you take about 3 deep breaths, on the 4th one or the 5th one, you're going to see, or you're going to start noticing things. I want you to look at the top hand, and I want you to look at your bottom hand, and I want you to see which hand moves more. Look when you're taking your deep breath in, is the top hand moving more than the bottom hand? Or is it the bottom hand moving more than the top hand? If the top hand is moving more than the bottom hand, you're most likely a chest breather. There's nothing wrong with being a chest breather. It's just something to note for. If your bottom hand is moving more than your top hand, you're most likely a diaphragmatic breather or a belly breather, like I like to call it. Now that you know kind of what your pattern is, I want you to really focus on that bottom hand. I want you to take a deep breath in through your nose, and I really want you to think about pushing that air into your bottom hand, into your belly, and then breathe out. You're going to do that a couple of times, breathing in through your nose, breathing out through your mouth. And every time you breathe in, I want you to put more air towards the bottom hand, trying to expand the belly as much as you can. This is a great exercise to strengthen the diaphragm muscle that lives right, like I said, right in between your rib cage and your abdominal cavity. Just like any muscle, it can be trained and it needs to be strengthened in order to do what it does best, which is breathe. It is super important because it helps not only breathe, but it also helps provide some stability to your core. It helps with your blood pressure. It helps lower your heart rate. It helps managing stress. It helps with relaxation, and it helps with like oxygen consumption in general. So at any point of your day, you're like really stressed, you're sitting at work, just take 3 minutes, put a timer on your phone, kind of like sit back, try to breathe in, try to breathe out, and try to really push that air through your belly. Try to have a little bit of some diaphragmatic breathing during the day. It's a drill everybody can do. If you're having a hard time doing it in a sitting position, you can lay back and just do it laying down. That'll be a little bit easier. And then go to sitting and then go progress to standing. But everybody should take a few minutes during the day and just kind of do it. Just oxygenate your brain, relax a little bit, and just strengthen your muscles. Perfect. Now that we've gone a little bit of what normal breathing is and proper diaphragmatic breathing is, I'm going to pass it up to Brittany, and she's going to take you a little bit about how to properly brace and how to put it all together. All yours, Britt.
Thanks, Andrea. So bracing and proper bracing is one of my favorite things to really hone in on and focus on when I'm doing my weightlifting exercises. So in terms of what bracing is and how do you do it, what does that mean, what muscles are used, we like to think of your core. I like to specify your central core. Your core does extend into your hip muscles and a little bit and above and beyond some of the ones listed. But if we're talking about, basic center core, you want to think of your 4 walls. So in the front, you have your rectus abdominis and your transverse abs. So that's going to be kind of right in your belly muscles. On the sides, we have something called your obliques. Again, something a lot of people are familiar with when training your core and training your abs. Along with your, on the sides, you have intercostals. What that means is just the muscles that actually help expand and collapse your ribs as you breathe. So that kind of ties into a little bit about what Andrea was speaking towards. And then on the back, you have paraspinals, which are basically a group of very small muscles that travel up and down your spine. and they provide a lot of stability for those joints. I mentioned QL specifically here too, because I think that's a very big, important muscle for stability and kind of balancing your hips and your lumbar spine. And then often forgot about is the bottom. So you have your pelvic floor. Those muscles are super important in bracing. If they're not active during your brace, what you're doing is actually pushing all that pressure down, and it can lead to some pelvic floor complications. If you've ever tuned into some of our seminars on that, we have a great couple therapists through our company that work with, basically problems that can arise from this, not just from lifting, but other issues as well. And you don't want to exacerbate any of those things as you try to work into a weightlifting regimen. What's not mentioned is the top, which would be your diaphragm, which is, what Andrea kind of spoke about. So that's our box. Those are the muscles that we want to make sure are engaged whenever we're starting our brace. So we can pull up the next slide and we'll talk a little bit about some common mistakes and how to fix them. So we'll circle back to rib flare. I'm going to have Andrea kind of demonstrate a little bit about that, but moving on to the pelvic floor pushing out. I think we have a QL question. Sure. So until that pops up. So pelvic floor pushing out. Sometimes, if we're bracing everything, we're kind of bearing down. What can happen is we end up pushing our pelvic floor. It almost feels like a pressure, in your bottom, in your pelvis. So what you want to think about as you're bracing is for females is sucking in with a straw. The cues that we use for men would be like holding in your pee. That's a very important cue to kind of have in the back of your head before you do any big lift. And then the last thing would be chest expansion. So if you're bracing and you're using your rib cage, you're taking some of the pressure out of your abdominis. And if you remember that slide that Andrea had up, the diaphragm forms as the top. So if you're chest breathing and taking the pressure above your diaphragm, you're taking away from this intra-abdominal pressure that we really want to focus on. So I'll have Andrea come on screen with me and we'll talk a little bit about the rib flaring. Great. So a lot of times you'll see people, okay, let's sit with good posture. And what's the first thing they do is they push their chest up, right? Big, high chests, their shoulders might be back. Yep, great posture, Andrea. So close, or slumpy posture. What we actually want to do is, yes, you want those shoulders down and back. And Andrea, if you can turn to the side again and kind of demonstrate, yes, shoulders down and back. And we'll have her do a rib flare, so chest is up. Looks good, right? Now let's keep the shoulders in that position, but tuck your rib cage down a little bit more. Good. So now you can kind of see her spine is a lot more neutral. And this translates well to your squat position. So I'm going to have Andrea get her barbell, her really heavy PVC barbell. Hopefully she doesn't hurt herself on this. And let's demonstrate from the side a rib flare squat. Good. And back up. So if you can see from this angle, there's a little bit of a compression through her, like what we call thoracolumbar junction, meaning where her thoracic spine, that middle back, meets her lumbar spine, is kind of crunched down, and it's because her ribs are up. Whereas now if we have Andrea take her little belly breath in, good posture, and then tuck her ribs down and go into her squat from there. Perfect. You can see that nice neutral spine as she went down. So super, super important as you're getting into that squat rack or, whatever position you're going to, even a front rack position. If you feel like you're rib flaring, you could be causing extra pressure on your discs, on your joints in your lower back, and even your thoracic spine. So really tucking those rib cage down will promote some spine health. So talked a little bit about breathing. We've talked a lot about bracing. And that is most of what we had on the script. I'll have Andrea come back on and we have a couple more discussion points to talk through. Andrea, did you want to get into the belt?
Yes, so we had a whole slide about the belt. I know most of us have seen it at the gym. Most of us are like, oh my God, the belt, I'm going to use the belt. I'm going to lift really, really heavy weights. But we decided to have a discussion about the belt and just kind of like tell you guys our thoughts about the belt. So Brittany, can you please demonstrate how to put the belt on? How do you put your belt on when you go to the gym? Okay. So this is a weightlifting belt. It's usually made of leather.
Pretty thick.
Yeah. I'm not going to get into the specifics, but there are some regulations in the weightlifting sport that the belt cannot be bigger than a size or smaller than a size. It is not relevant. But ideally, I mean, as you can tell, that belt is getting very tight and very snug on Brittany's waist. So you kind of like, if you ever decide to wear a belt, which we'll go into a little bit, you kind of like want to look at your rib. You don't want to put it on your ribs. It's just going to compress your ribs. You don't want to put it on your hips because it's just going to compress the ribs. So you want to find that space that it's right in between your hips and your like pelvis bone. So like from here to here, the belt's going to go right around that space. How tight do you have the belt on, Britt?
I have it pretty darn tight.
Can you breathe though?
I can breathe. I can breathe well. What's important with your belt is that if it's too loose, then you have to work extra hard just to make contact with it in your breath, right? If it's too tight, you can't get your good diaphragmatic breath in that we talked about. So the position I have it in right now, you can see I can take my hand position, breathe out into the belt here. I have all that pressure through my diaphragm. And if you notice, my chest didn't raise, and then release.
Perfect, great. So the purpose of the belt, it's not to help your back. It is not to support your low back. The purpose of the belt is to give you an external cue to press towards, for your diaphragm to press forward. So what Brittany was referring a little bit, is like, if the belt's really loose, there's just going to be too much space in between your belly and the belt, and you're going to have to make like a pouch in front of you just to press towards it. So the belt needs to be snug. Usually a finger or two in between the belt will be a good ideal. And what you're going to do is you're going to do the same drill you did at the beginning. You're going to push towards that belt, still keeping your rib cage stacked on top of your hips, and that will help you create a little bit more stability through your core. That's what the purpose of the belt is for. It's not to protect your back. It's not to not get you low back pain. And it is not to be used if you already have pain. Very, very important. I know it's a huge thing, especially in the sport. I'm like, oh, I'm going to lift really, really heavy weights. I have to use my belt. If you're using your belt because you're having back pain, that is probably not the right way to do it. You should probably look for some help. The right instances to wear the belt will be if you're doing a lot of volume during the day and you know that maybe at the end of the session your back is going to get fatigued. However, it's a weight that you can manage. That would be a right way to use the belt. Or if you're going to do for like a 1 rep max in a competition, that may be, not telling you that's why you have to do it. That may be a good option to do it. Usually a good rule of thumb that I tell myself and I tell all of my athletes, if you cannot lift the weight without the belt, without pain, you should probably not be using the belt. It's not worth it. It's not going to get you any stronger. 1 repetition at a heavier weight is just not going to get you stronger by using the belt. When do you use the belt, Britt?
I use the belt as a tool, and I have it strategically planned into my training days. So if I'm testing a 1 rep max, like you mentioned, if I'm doing a high load, low repetition day, if I want to get through a ton of other, exercises before or after it, and I just feel like I need that little extra support, I'll use my belt for those days. I love my belt. I feel great when I squat with it. Most people do, which is why they want to use it. But you want to make sure that you're using it as a tool and not as a crutch. Like, I can't squat unless I have my belt. That's a no-go. The other thing is that on days that you use your belt, it's a really good idea to do an extra core work that day. Really, really train, make sure you're doing the outside work, that you are training your core strength, you're training your proper bracing, your proper breathing, and you're using your brace as an extra tool. On the days that the belt is an extra tool. On the days that I don't use my belt are like my volume days, or days that I'm maybe not doing as much other core work and I'm really, really focusing and honing in on that skill. So tool, not a crutch.
You can start thinking of the belt as like, well, the more you use the belt, the less your core is going to have to like work for it and less awareness you're going to bring to your core. So it is something to use occasionally. It's something to have in your toolbox, but not to use every training session. It's definitely not something that I'm like, oh, there's squat day. There could be front squat or back squat, or heavy day pressing overhead. Oh, I'm going to use my belt, and you use your belt 5 days a week. You're kind of like defeating the purpose. You're kind of doing yourself a disservice, and you're kind of just like setting yourself up for failure. Really be smart about it. When in doubt, if you don't know when to use the belt, don't use it. That is the best and the best thing I can tell you about the belt. If you don't know when to use it or how to use it, you can ask somebody to teach you how to use it. But if you're like, well, should I use it or not? My lift, are they too heavy? Don't use it. You're gonna get more out of it if you don't use it.
Totally agree. The last thing that we really wanted to touch on was talking about the infamous Valsalva Mover. I'm sure most people have heard of this. It's painted as like a big red demon in a lot of context. But we'll talk a little bit about its usefulness. Same thing with the belt. So what is the Valsalva Maneuver? It is essentially a maneuver where you brace your core and hold your breath at the same time to create an increase in abdominal pressure, intra-abdominal pressure, so that you can further support your lumbar spine during the lift. Yes, it does increase. There is multiple research studies showing it increases your intra-abdominal pressure, which is kind of that like little core box that we've talked about before. And we do know that increasing that pressure leads to increased lumbar stability. So sounds great. The downside of the Valsalva is that it does increase your blood pressure temporarily, as well as your heart rate. So what that can do is if you have pre-existing conditions, it does put you at risk for a cardiovascular incident. This maneuver is not recommended for anyone that has a history of a cardiovascular disease or complication. It can be used in a safe and useful way by healthy adults, healthy athletes, as long as you're doing it correctly. So some common mistakes with the Valsalva, similarly like with common mistakes with the belt and your bracing, is that when people hold their breath, they push out through their head. If you feel pressure behind your eyes or in your face or in your head, or you feel dizzy or lightheaded, it means that you're not sealing at your throat and you're pushing out through your head. That's when you're going to have the dizziness, the lightheadedness. That's when people pass out. And it's not because they're Valsalvaing, they're doing it incorrectly. The correct way to do your Valsalva would be take your belly breath, your diaphragm breath, you're going to brace your core, and then you're actually shutting off at a level in your throat. So you have something called your glottis. It's almost like you're swallowing, like you're closing off from your breath here. You should not feel any pressure coming through your face. So if that's done correctly, if you brace here, hold your breath through your throat, not through your head, and you do it for under 3 seconds, there's very, very low incidence of anyone having a complication from this maneuver. So similar to the belt, useful tool. Don't do it if you have any pre-existing conditions or health conditions. If you are unsure, always consult with the doctor or personal trainer or something before even trying it.
Usually Valsalva maneuvers are used for like experienced athletes. 1, 2, also if you're attempting like very heavy set repetitions, usually single repetitions, like Britt said, hold for 3 seconds. You can only probably get 1 repetition in 3 seconds. Anything more than that, it shouldn't be more than 3 seconds. It's just not going to be beneficial for you. So think of that. If you don't know how to do it, ask somebody that knows how to do it. Ask your weightlifting coach, ask your CrossFit coach, ask a personal trainer. 1, if it's worth for you, learn how to do it, and 2, how to properly do it. Don't Google it. It's not a good idea. Don't Google this kind of stuff. Don't play with your health. So if you have questions, ask an expert. Perfect. Me and Bray want to go through a couple of more things with you before we let you guys go lift heavy things. So we talk about breathing. We talk about diaphragmatic breathing. We told you about how to brace. Now we're going to talk a little bit, just demonstrate a couple of stuff. How will you put it all together, and how will you lift things, brace properly, and what cues to use. So the premises, or like something you always want to keep in mind, you want to inhale when you're doing the eccentric movement. which we'll go into. I'll show you guys what eccentric means. And then you want to exhale when you do the concentric movement. This will allow for like continuous breathing. So you're going to breathe in and out every single repetition, which is going to give you a couple things. One, it's going to prevent you from getting dizzy. Two, it's going to make sure your blood has oxygen in it to supply the muscles that you're working with. Three, it's going to make sure it's going to allow you to do a lot of volume or a lot of repetitions, 4, 5, 6, 7, 8, 9, 10, as many as you need to do on your set, and complete your training session without being super fatigued, super dizzy, and just not feeling great. So, Britt, do you have a kettlebell or something heavy you can lift?
It's so heavy.
Oh God, I love it. So, eccentric part of the movement is pretty much the harder part of the movement. So for a squat will be the lowering part of the movement. For a deadlift, we'll be bringing the weight down onto the ground. So Brittany is going to demonstrate a deadlift for us. You can be straight leg or regular deadlift. So from here, Brittany's going to hinge back, send your hips back, slightly bend her knees, going to reach the kettlebell. She is going to exhale and going to lift up. When she's up, she's going to squeeze nice and tight. Hold right there 1 second. Wait, hold. Yeah, notice right there how her rib cage is on top of her hips. Can you flare your hips, please? Can you flare your ribs? Look how her belly's sticking out, the breaking point in her low back. It's going to make her have back pain and come see me later. She's going to tuck her. Yeah, there you go. Thank you for tucking in. And then she's going to exhale out. So she's going to breathe out and lower that weight onto the ground. So she's going to breathe in on the way up, and then she's going to breathe out on the way down. There we go. Brittany, how many repetitions of that can you do?
At least 100.
There we go. She's breathing through it. She's not going to get dizzy. She's properly bracing, and she's just going to be able to do all the sets that she needs to do for training.
Great. So that's a great technique for your volume lifters or anyone who is not able or shouldn't be doing a Valsalva maneuver. We're going to have our squat specialist, Andrea, demonstrate how to do a Valsalva in your squat position. So we've talked about the diaphragmatic breath. Great. We've talked about bracing, whether you're using a belt or no belt. Same thing. Ribs are tucked. Her pelvic floor is active here. Good. And in this position, she's nice and tucked and set. Her posture is the first key. And in this position, she's going to take her big belly breath. And then she's going to hold, pushing through her throat. She's going to lower down into her squat. 1, 2, 3. Come back up and exhale. Good. So that Valsalva was 3 seconds. It was on the way down and at the bottom of her squat. And then she's using her exhale to help push and drive herself up. So we'll do that one more time. Posture set, ribs are tucked, spine is neutral, pelvic floor is engaged here. Big belly breath. Hold through the throat, go down. 1, 2, 3. Exhale as she's coming back up. It's kind of like you're blowing yourself away from the floor. You're using all that pent up energy. So that is a great technique. You can do it with small volume. But more so useful if you're using like your 1 rep max and you know that you need all that stability and all that intra-abdominal pressure to keep your back healthy. All right. So I think that, unless Andrea, do you have anything else to add?
No, I think we got most of it.
All right, we got through it. So that's all of our talking points. We do have our Q&A open. So I think Todd, if you want to, and Kyle, start going through that.
All right, great job, ladies. Let's see, we have some great stuff in the Q&A. Like Brittany just mentioned, anybody who has any questions, please feel free to put them into the Q&A and we'll do our best to get to everybody either on screen live here or answering privately in the background as well. All right, so a couple different things came up, guys, during it. Iris has a question in terms of the diaphragm being an involuntary muscle. How do you focus on relaxing the skeletal muscles so that you allow the diaphragm to do what it's supposed to do?
So that's a great question, because for most of us, especially that live in New York City, relaxation is not in our dictionary. So I mean, it's really about bringing self-awareness to yourself. A lot of the times the muscles up on your neck, your rest of your muscles get really, really tight and they want to take the job out of it. That's why the verbal cues are like seeing where you're breathing through makes a huge help. So if you're breathing through your chest, so your upper chest, you're probably using those other muscles to kind of like help you breathe. You really, really want to focus on trying to keep the chest muscle or the top muscle kind of like relaxed, and just really think about pushing through your belly. If you're breathing through your belly, you're using your diaphragm to breathe. There will always be some accessory muscle, all their skeletal muscles helping, because that's what they're there for, to accessorize and help. But the main movement should be from your belly.
Yeah, another good thing to think about if you're trying to decrease how much like you feel like your skeletal muscles are moving and your chest muscles are moving, we have a tendency to actually increase your accessory muscle recruitment when our hands are splinted. So if any of you played like sports in middle school or high school and they tell you can't like bend over and you can't get on your knees, one of the reasons for that is that as you splint here, we tend to actually breathe through our intercostals more and through our chest more. So if your hands are free, it's easier to actually recruit your diaphragm. You can use them as like a gentle placement here, but if your hand, overhead, if your hands are braced on something, it cues your body to use more of your accessory muscles. That's why we want to do it. That's why our bodies are, they're trying to cheat. But if you're trying to train how to use your diaphragm, don't splint your hands on something when you're out of breath.
Awesome. Guy has a question. I'll kind of broaden it out a little bit. How do we know what kind of weights to use? Like for somebody who may be older, maybe a little bit more inexperienced, obviously lighter weights may be the option. But what do you guys usually tell your patients in terms of how do you start with weights and knowing where to start?
I would suggest see how you feel with household objects is a great way to think about it, right? It's like if you're picking up your hamper, your laundry basket, and that's going to weigh like 10, 15 pounds or so. And that feels like pretty heavy, you shouldn't be picking up a 30-pound dumbbell. Or if you bend over to pick up your backpack or the cat's litter box or something, you can kind of estimate how much that might feel or compare it to a weight in the gym. If you have any pain or difficulty lifting those things in your household, you shouldn't necessarily be lifting more than that in the gym. You should be working on honing in on those skills. Granted, some of them are kind of awkward and bumbly, so it's if I can lift my laundry basket and it weighs 15 pounds and that feels totally fine, great. Maybe I'll try 20 pounds in a dumbbell or a squat rack because that's a lot less weight or it's positioned better. So I think for people who have never weightlifted or picked up something and are just trying to get into it for the first time, compare it to your household, what you have done before. Andrea, do you have any?
Yeah, and on the other side, if you've been to the gym, you just haven't been to the gym in a while, which is most of us at this point because of the pandemic, just start with something. I like to start my new clients that I don't know where a good entry point is, like pick a weight that they can do for 10 repetitions. So the last 8-10 repetitions should be a little bit challenging, but you should be able to complete 8 repetitions and still have something in the tank. Once you do that for about 2, 3, 4 sets, depending on how many movements you're trying to do during the day, but like about 4 to 6 sets of 10 repetitions, it's a good entry point. See how you feel the next day. If you're really sore, then you did too much. If you're like, okay, I feel pretty good, I feel like I worked out, but I could push myself a little bit harder, then take the day off. Don't recommend doing the same muscles in the same day or back to back. Take the day off and you can go to the next one. So you did 30 for 10 repetitions, then maybe I'll go to 35 and I'll do 10 repetitions. When you find that 10 rep max or 10, you do 10 repetitions and you're like, okay, that was challenging, I'm not sure if I can do one more, then you can play around with that number. And there's a lot of calculators that can help you figure it out. Based on that 10 rep max, based on what you want. If you want to get stronger, if you want some hypertrophy in your muscles, they'll help you figure it out what weight and what rep range to work with. It's very individualized. That was a very broad answer, but if you have any questions, you should definitely ask personal trainer, physical therapist, somebody this is what they do.
Awesome. Some of the breathing techniques you guys expanded on, somebody had a question as it pertains to when you take that deep breath and you feel the ribs lift up. Is that the same or is that different from some of the breathing techniques that people learn in Pilates and yoga, or is that a completely different entity?
Meaning that they do train rib
So when you go through the breathing technique, right, where you breathe deep and you feel the ribs lift up, is that the same as what instructors typically teach in Pilates and yoga, or is that different?
I think it can vary. I will not pretend to be a yoga expert, but we call it something called like segmental breathing is used through a lot of like Eastern medicine too, where yes, you should know how to train your diaphragm, but also you do want to know how to expand your ribs. And I do think that's something that they train in yoga. And the difference is that they're not lifting anything heavy. So the yoga practice is beneficial because it does teach you how to control these upper rib muscles. It teaches you how to control, we have muscles through our neck that also help elevate our rib cage. And if those get tight, sometimes people can feel like curved in and it affects your posture and it can cause pain here. So it's important to know how to do this. And I think if I'm answering this question correctly, that is a yoga practice, right? As they teach you how to expand your chest, how to expand your ribs, and it does kind of get into good posture, but you want to make sure as you expand this way, you're still tucking and active here in your posture. So different purposes of the breathing, chest breathing can be great if you're just trying to open and relax the muscles, or just getting maximal air in. But diaphragm breathing is going to give you better lumbar stability when you're lifting heavy things.
Thanks, Britt. Next one is, someone says they notice pressure in their eyes when they do heavy deadlifts. Is that due to improper form in breath?
It's your Valsalva, your breath. If you're holding, sorry, Andrea, I'm stealing.
No, please, you're too excited
High
about
pressure
it.
is a passion of mine. If you're deadlifting and you're feeling that pressure in your head, it's because you're not blocking at your throat. I know it's a weird cue, and we can even practice it maybe a little bit right now. It's hard to demonstrate while you're talking it, but essentially what you're trying to do is almost like you're swallowing as you're holding your breath. If your throat feels relaxed, you're going to get that eye pressure. I would also take a look at how you're breathing and when you're breathing in your deadlift. Even if you're repping out your deadlifts, you can exhale. What Andrea kind of walked through is that concentric eccentric motion. So either you might be holding your breath for too long, even if you're doing a proper Valsalva, or you're likely not closing off at your throat and you're allowing it to come through your head.
Awesome. Andrea, I'll throw you one over here.
Oh, thank you.
So someone had a question about learning how to do a clean from a trainer that they were working with. And they were wondering, is that a good position? Can you be injured? How do you do it properly?
With a clean?
With a clean, kettlebell
Yes.
clean.
Yes. Actually, kettlebell cleans are a great way to start with weightlifting because the risk of injury is a lot less than with a barbell. So when you're doing barbell cleans or barbell snatches, because your body is, thank you, Britt, that's what a clean looks like.
For anyone who doesn't know what a clean looks like.
Yeah, because with the barbell, your arms are attached to it. You have to have the mobility for it. You have to have the strength to support all of it. With the clean, it gives you a little more of a wiggle room, it gives you a little bit more wiggle room, still training the movements, still training the same muscles. Both of the movements, the clean and the jerk and the snatch, are like total body movements because you use all of your legs, all of your upper back, and all of your core. So they're fantastic for developing overall strength. The kettlebell, it's an awesome way to develop power, develop proprioception, and just develop the movement itself. So you have to have a good trainer that will be able to like give you the proper cues and tell you what you're doing wrong or fix the right things. But the kettlebell, it's a great entry point for to start weightlifting.
Alrighty. James has a question. He's saying he's finding it difficult to engage his pelvic floor while doing belly breathing. What kind of tips do you guys have for that?
You could try breaking them apart first. So really, I think generally men have a harder time with learning the pelvic floor contraction. So sometimes maybe just laying on your back, do a pelvic floor contraction. We talked about that cue being like you're holding in your pee. Don't worry about your diaphragm first, and then relax the pelvic floor. Then do a diaphragm breath, then relax. Then you can try adding them in separately. So instead of trying to do both at the same time, if your pelvic floor is the one that you're having more difficulty with, I would say do that first. So hold the pee in, contract the pelvic floor, then keeping that tension, try and slowly do your diaphragm breath. You can try it laying down to start, it might be easier. And then you can kind of progress to sitting, standing from there.
I'm going to piggyback on that. I think a lot of travels are a lot of problems that I've seen with my athletes is that they do the diaphragmatic breathing and they do it right. The thing is that they go so far into the diaphragm that it presses down into their pelvic floor so much. And that will be their weak link. So that's where they start feeling, they start leaking, they start having problems with the pelvic floor. So what I usually tell my friends, my athletes, is just like, don't go get tight on your diaphragm, but just don't breathe all the way in that you have nowhere to go. Give yourself a little bit of like wiggle room, because when you put that bar on your back, once you like lift that heavy weight, compression is going to put even more weight on it. So if you're having problems just basically engaging the pelvic floor, one, you probably need to do a little bit of strengthening. Two, you're going to have even a harder time when you put the weight on top, just completely smashing down on the pelvic floor.
One last thing, Andrea, I think you brought up a good point, is taking too much of a diaphragm breath. Weightlifting is going to be different from your endurance sports or sports like swimming, right? Where each breath you're trying to get as much as possible because you need to circle that oxygen through a prolonged time. If you're breathing consistently through the movement, or even your Valsalva, you're only holding it for 3 seconds, you don't need to take the largest of belly breaths. You just need enough that it's active or it's pushing against the belt if you're using one. But it doesn't have to be like the biggest diaphragm breath you can possibly take.
So, all right. Just a reminder, anybody who's still tuned in with us, please use the Q&A feature. We'll try to answer as many of these questions as we can here before we wrap up. Mike has a question. What happens to your lumbar spine during the Valsalva maneuver?
The Valsalva maneuver actually does increase, so it's kind of chain effect here. If your Valsalva improves your intra-abdominal pressure, there's research showing that your intra-abdominal pressure improves lumbar spine stability, measured through how active your lumbar spine muscles are. So it does actually improve the stability in those like small joints in your spine.
That's the point of the Valsalva maneuver, to create that intra-abdominal pressure to stabilize your lumbar spine. Usually lumbar spines and spine in general tends to be the weak point of the lifts, just because it has less muscles, or the muscles in the legs and the muscles in the upper arms are the strongest. So athletes, they try to find any way they can to provide as much stability. Valsalva, it's the way that they achieve that. They achieve the like intersegmental stability by by stacking everything up and down, and just putting air and interpressure on their tummy to achieve the lift.
All right, thank you guys. Got a quick hitter for you here. Is it imperative to bend one's knees when picking something up from the ground?
No, if you have excellent hamstring strength and stability, you can absolutely, if you have the range of motion and the object, can't see my screen, the object's not too far away from you.
Or too heavy.
This is again if you're trying to maintain lumbar stability and straightness. So if my hamstrings can do this motion, you see my back is almost even a little too arched. My back is pretty flat. I can pick this dumbbell up, or kettlebell will be fine, right? It's also not inherently bad. There's a running joke. Your PTs want you to go around like lifting everything like this. So it's not terrible if I'm not picking up heavy weight and I'm just gonna get something from the floor. Yeah, you can have a little bit of a round here. That's okay. What you don't want to do is load in this rounded position. So it depends on the weight of the object, and it depends on what your body's capable of.
The reason why as physical therapists we tell you to bend your knees, it's because your quad muscles are usually stronger than your hamstring muscles and your back muscles are. So we usually want to use the strongest muscle to do the lifts. However, if you're going to pick up a water bottle, you're not going to go around like Brittany went and just be like, wait, she told me to bend the knees. I have to bend the knees. Where are they?
PT said
they're bent. Yeah. So like totally fine. Go over, like think about it. Go down, pick up the water bottle. You don't like, it's not a all or nothing. It's a very great area. It's depending on like how strong you are, your capabilities. It also depends on how your back feels. If your back's like super aggravated. I know that when I lift really heavy, sometimes my back is a little bit achy. And then picking something from the ground with my knees straight, it's kind of like, oh, that's not great. Can I do it? Yes. Will it break my back? No. Will it be easier if I bend my knees? Probably.
All right, got another one coming in here. Should I use the Valsalva maneuver only with heavy weights, or can I use it with lighter weights?
I would say I'm not going to say this is like something I've researched and have this opinion, or rather something I'm going from evidence. I would say this is my personal opinion on it. I think that you can use it with lower weights if you're using it correctly. If you feel when you don't Valsalva that you're having some like pressures, having trouble like getting that same level of stability, fine, you can use it. I wouldn't use it every single time, but that probably means that you need to work on like your bracing technique without the Valsalva. So I would say like, yes, it's probably safe if you're following those same guidelines, throat closure, less than 3 seconds. And you're taking good breaths in between it. So you're not Valsalving for like 10 reps. You're doing one rep with the Valsalva, reset your breathing. 1 rep with Valsalva, reset your breathing. You don't want to do like 5 reps in a Valsalva.
Yeah. I usually would stick like 3 reps in terms of like, you get started. It's very time consuming to like go up, go down, reset, go up, go down, reset. After 3 reps, I'm assuming this is also heavy-ish. It doesn't have to be a 1 rep max. If it's heavy-ish, you can't do it. I also thought about like training purposes. Like if you're an athlete or if you're like a lifter and you're going for heavy lifts, you do want to train your Valsalva maneuver on lighter weights because that's your training. That's what you're going to be doing. That's what you're going to be performing. So if you want to perform that, you need to practice it at an easier weight and not challenge yourself all the way, or not just do it when you're really, really heavy lifting. It's a little bit of like, yes, you can practice it at heavier weights if that's something that it's going to be beneficial for you in the long run.
All righty. I'll go for one more question here. And again, if anybody has missed anything or wants clarification, we're going to post this on our YouTube page and Instagram, I believe. So the recording will be up there in a little bit. Last question. Why do I feel dizzy or even lightheaded after finishing a set of squats sometimes?
Yeah. Yeah, actually, we both probably. I would probably say it's on your technique with the Valsalva if you're doing that, or how you're planning your breathing. The other thing is that sometimes people, like I keep saying, like, oh, if you're Valsalving, and someone might say, like, oh, I don't do that. Sometimes we do it unconsciously. So it's actually the Valsalva is a reflex. When your body is performing work, it wants to hold its breath in. It's kind of like, a safety mechanism because it does increase that stability. So it's going to be our reflex to do it. You might be Valsalving and not even know it. And it could be short. Maybe you're Valsalving just for, that way down and up, right? And then you're breathing, you're like, oh no, I'm breathing between reps. But if you're accidentally doing it and you're not paying attention to it, you might be causing that head pressure that we've talked about. If you're very, very adamant that like, no, I'm not holding my breath at all. It could be just kind of like your pace with your breathing. Are you breathing every single rep? Is it even? And are you getting good oxygen in each breath? You could be shallow breathing, which can also cause the lightheadedness. Andrea, did you have anything else?
Yes, it's funny because I used to be that person. When I started weightlifting, I used to be the person that would get dizzy after my squats and I'd be like, why am I getting, like, I don't understand. And it's because I will just like go in, put my bar behind my back, just go down, up and down 10 times. And then I will put the bar down. I'm like, oh my God. I'm like, literally had to like hold on to something because I was like, why am I so dizzy? And it's because I wasn't breathing at all. I was just doing like sets of 6, sets of 7, 8 without breathing. So holding my breath because that's what's going to provide me stability. That is Valsalva. It's not meant for that. But at that time, I didn't know that's what it was. Somebody else had to come tell me to like, okay, when you're going down, you're going to breathe. You're going to breathe out. When you're going to come up, when you're going to go down, you're going to breathe, and you're going to go up, you're going to let out. So like, you have to take breath. It doesn't necessarily have to be every rep, but like if you're doing bigger sets of like 6, 7, 8, do 2 reps, take a breath, do 2 reps and take a break. Just break them up, breathe throughout it. And I'm sure you're not going to feel dizzy when you're done.
Yeah. Another great point, you just kind of reminded me, practice breathing in different positions of the weight or the movement that you're training in. So I actually recently had this kind of like aha moment where I was training clean and jerks and I was in my front rack, like jerk position with the barbell across here. And I realized I was like, I can't take a breath in this position. And I was like training a heavy load that day. So I'm like, I have to somehow propel this, over my head to do the jerk, but I couldn't get any oxygen and I hadn't really practiced how to breathe with weight on my shoulders like that. So that's something I kind of like, I practice in a barbell position. I practice just pressing up against a squat rack or something and just train my body. How do I breathe in this weird position that's very different than how I breathe normally or with any other lift I had been doing at the time. So if you're starting a new movement, before you load the weight on it, get in that position, see if you can, turn on and off your diaphragm, see if you can turn on and off your pelvic floor, your abs, if you can take a good breath in each position, and that way it'll carry over to when you're in a loaded squat or loaded movement.
All right. Well, thank you, ladies, for such a great seminar. We hope you all who are joining us today got some value out of this. I know I did, and learned a little bit more about the sport of weightlifting, bracing during heavy lifts, proper breathing, and lifting techniques. If we didn't get to your question, we'll do our best to reach out to you directly afterwards. We'll also be sending a handout after the webinar with a recap of all the important facts, as well as some exercises for you to have as a reference. And we'll also be posting the recording of this as well, as I mentioned. Just as a reminder of your panelists, who they were today, we have Brittany Smith and Andrea Bettini, both in our Brooklyn locations, Britt out of the Brooklyn Heights office and Andrea out of our Park Slope office. We'll leave their emails up for a couple of seconds. If you guys want to reach out to them, please reach out to any of us directly and we'll be happy to guide you with any questions you may have. We're getting you set up for an appointment at any one of our locations, not just our Brooklyn locations as well. Leave those guys up for a couple of seconds. And then additionally, we'll put myself and Brett, who are manning the Q&A in the background. So thank you, Brett, for being on top of that as well. So here's our contact info. As I said, I work out of our Pleasantville office up in the Westchester area, and Brett is also in Brooklyn. So for anybody in any of those locations, as well as Manhattan, Queens, and any other place we have our offices, again, you can reach out to any of us and we'll be happy to guide you with any questions you can have or getting to see any one of our therapists amongst our 20 locations. All right, so at Spear, we treat an array of conditions from head to toe, not just with weightlifting and back pain and breathing and things of that sort. We're open for in-person visits as well as telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment from any of these wonderful panelists or any of our therapists, don't hesitate to reach out to any one of us, and we'll be happy to coordinate with you personally and set you up with one of our team members. Lastly, we'll be continuing these webinars through 2021, covering a variety of topics. We look forward to seeing you all there. Please give us a follow on social media and check your inboxes to learn a little bit more about some upcoming events and topics. On behalf of everybody, thank you all so much for joining us and have a wonderful evening. Bye, everybody.